Hello guys, so let's move on in our course here. Now we are going to address the center of gravity, which is very important for us. As we know, when I apply a kind of force, given the center of resistance, the distance from the center of resistance to the line of action, we know, and we will address this in a few slides ahead, but we know that we are going to have some differences in movements depending on this relationship between the line of action of the force and the center of resistance. Okay, so the center of gravity, before talking about the center of resistance itself, it's in physics an imaginary point in a body of matter where, for convenience, in certain calculations, the total weight of the body may be thought to be concentrated, meaning so all forces are annihilated, are cancelled in that body. This is the point in which if I apply a force going through it, that body goes like a translatory movement. I know I'm jumping a little bit ahead in this concept, but I know you know that. And we will explain in a few slides. But this is important. This point is very important for us as orthodontists because we are applying force against some bodies, against a tooth, a group of teeth. We are applying force with the different line of action. So this is important for us to understand, okay? Let's move on. For example, I'm using here this baseball bat for this kind of a representation of the line of action and the center of gravity. If I'm applying the force in the exact or through the exact center of gravity of this body, in this case, this bat, this movement of the bat is going to be a translatory movement. A translation will occur in which all points of this body are going to go in the same direction, the same sense, and with the same magnitude. All those points are going up. The center of the center of gravity is going up, and all those points, the neighboring points, are also going up. But what happens when I change the point of application and I change in relation to this, the line of action of the force that I am applying here? What's going to happen in this situation? The center of gravity still goes up, but now the way the body is going to move is not all the body, all the points in the same direction. As you can see here, we're going up with the center of gravity, but we are applying another thing here, which is a tendency to rotate that body, in this case this bat, and we are going to learn about this in another session of our course, but we know that this is what happens in orthodontics. When we apply a force outside the center, in this case, our case, the center of resistance, I'm going further here in our knowledge, but in the center of resistance, this movement that is related to this line of action is not going to be a movement of a translation of that body. We know this, and this is the same thing here. And as we know, we are not applying a force in a tooth outside in the space, free of everything. This tooth or a group of teeth, they are restrained by the periodontal ligament, by the bone, by the gingival attachment and everything. So this is different for us because we are not applying this force in that exact point that is supposed to be the center of gravity, because this body is not free, it is restrained. So in this situation, if we apply the force in that same center of gravity that we saw before, is it going to have the same outcome? Of course not. The center of gravity now is closer to the hand. We know that by nature. We know that if we apply a force like closer to that point that we are restraining that body, we tend to move like in a more translatory movement. We know that. So we are moving the hand and the finger closer to that point of restriction, okay? And now we can have a different situation, a different relationship between the center of gravity. In this case, we are not calling it anymore the center of gravity, but something different, the center of resistance. Because, as I told you before, this is not free. This is not a free body. It's restrained, and we call it the center of resistance. And we know by calculation of some articles before that is located in a different position from its center of gravity, okay, or center of mass. And in a single tooth with good periodontal condition, so this is something that we have to keep in mind. We can't think that we are applying like a formula, like a cake recipe for all the teeth that are moving, because we have differences in the size of the root and the periodontal ligament, in the bone height, in everything, so, and bone density. So we can start from something. We start from something that we know that is the average, but we have to understand that we need to calculate, we need to see that movement that we want to apply, because we're going to learn how to calculate this movement. We need to understand that we are not doing that for every teeth that we apply in the force the same way. We need to do the movement, we need to anticipate the movement, we need to plan for the movement we want, but it's important that we need to have that in mind, that all times that a patient come back to our office, we have to reassess that, to understand, is it the movement that I really want that's going on here, or I have to do some kind of adjustment to move the way I want, the way I'm planning that to happen. You understand that? So I have to keep in mind some points to start with. I know that for a single tooth with good periodontal condition, the center of resistance is located between the coronal third and the middle third of the root. This is something that for average it will work. So I have to start at some point. This is the point in which I'm going to start. But we need to do all the adjustments needed during the treatment, during the movement that it's occurring, okay? So this is important, because we know that we have some situations in which our patient present a periodontal loss, bone loss. So is it the same center of resistance? No, it's not. It goes up. It goes up inside the bone. So if I want to apply the force, a single force at this center of resistance of teeth with periodontal losses, I need to go up with this force. If I'm applying, for example, a high hook for that, I have to go higher with this hook, with the tip of this hook. So in this case, if I want to apply, and yes, especially in periodontal problems, in patients with periodontal problems, I want to apply less force and the force closer to the center of resistance. We will see that in this course, okay? So here we have this different condition, and I need to calculate the whole time, all the time, the center of resistance related to the center of the center of resistance related to the line of action of the force I'm applying in all the movements in a three-dimensional view. Now, for example, I'm applying here upwards this force. I have to calculate, I have to understand the relationship between this kind of force I'm applying here with the center of resistance, which in some situations, as it's depicted here, is far from the position that comparing to a healthy periodontal status, okay? This is important, and we are going to focus on this point and many aspects of our biomechanics course, okay? So we're moving on. The center of resistance, for example, for a multi-rooted tooth, is likely to be between the roots 1 or 2 millimeters apical to the furcation, okay? So this is another thing that is related to a healthy periodontal status, to a healthy periodontal tooth, okay? And in this case, if we apply a force close to the center of resistance, We used that a lot before in the past, using, for example, a extraoral headgear for that, an extraoral force for that. We used to calibrate the line of action of the force, the elastic, to try to pass through the center of resistance of this tooth or those teeth, both molars. So we needed that. Visually speaking, it was very difficult, but we tried to do that before, using the line of action as a reference to pass through, or if I wanted to correct the angulation of those teeth, I would go up or down, meaning trying to put the line of action of the force in the right position to have the right movement that I wanted. So for that, I used this kind of reference, meaning, again, I'm using a point that is an average point. We need to understand that we have differences related to many aspects of the teeth or tooth, like, as I told you before, the root area, the periodontal status, and the bone density, and many things related to that, because we are not applying a force in a free body, as I told you since the beginning. Okay, moving on. Think the center of resistance as a point that needs to be evaluated three-dimensionally, meaning I'm not just using this force in a lateral view. I have to understand that. Let's make another example of that. I'm applying the force buccally, and I'm using the center of rotation, the center of resistance in this lateral view. But as I'm applying the force buccal to the center of resistance in an occlusal view or in a frontal view, I'm going to generate some kind of resultant forces. Not just looking at this view, but looking of the occlusal aspect and the coronal cut that we made this way. We have to understand that that force I'm applying, that force will have another kind of resultant related to these other views. So not just one view, because we are not applying a force against a bidimensional object, it's a three-dimensional object. So we need to anticipate the movements that we are applying, that we are having when I use other views for assessing that, for evaluating that. Okay, we need to understand these other views in all situations. Okay, so when I'm using a group of teeth, I need to understand again what is the center of resistance that I may use for that body. If I'm using a rigid ligation for that, because it's different from, for example, here, if I'm considering to be the six teeth, or the six anterior teeth, one body to be moved, and I'm using a force, a single force for that, because now we're just understanding one vector, I'm applying a single force for that kind of movement. I need to ligate those teeth in a rigid situation, a rigid aspect, a rigid condition. Meaning, if I'm using a round wire or an undersized arch wire for doing this, it's not the same thing. I'm not getting those teeth ligated. So I have to understand in this situation, if I'm applying a force with not rigid arch wire, undersized arch wire, or a round arch wire, I can't consider those teeth to be rigid ligated. This is not a body. In this condition, we have 6 different bodies that we have to understand, and we have to anticipate the movement of those 6 bodies separately, not ligated, because I'm not using here a rigid ligation for that. Why is this important? Because I see many people using this kind of concept, thinking that they're using the same center of resistance of the 6 body together, the 6 teeth together, but they are not, because they're using, for example, a 1625 arch wire in a 2230 slot. So this is not a rigid ligation. It will allow those teeth to move separately. And this is not the same thing for us, okay? Just something that I remember now, because I see that very often. I see people saying, we're using here this six teeth to be ligated together, and we are applying the force close to the center of resistance. I'm gonna show you that is wrong. That is the wrong concept. Let's move on. So for that, we need to have a rigid body, a rigid arch wire, very tight ligated to those teeth, to have those teeth together to be considered just one body, okay? We have also the center of resistance when we are applying a force to a different structure, for example, the maxilla, which is ligated to the skull by sutures. So if you consider to have a force applied against the maxilla to do the retraction of the whole body, of the whole maxilla. I mean, I'm doing now orthopedics, not orthodontics. So I also have a center of resistance to consider, to have the force passing through the center of resistance, up or below the center of resistance, in order to achieve the right kind of movement that I want, that I planned for. So we have all those center of resistance calculated for us. We have many articles that have this kind of information, and you can go anytime in our references to see those articles. You go to our ebook and see where you can find those information. So for now, understanding the center of resistance, that we have a center of resistance that is different from the center of gravity or center of mass, is what's important for us, okay? So from here, we're going to apply this concept to understand the kind of force that we are applying to the body, the height, and everything is related to the center of resistance and the line of force, the line of action of the force we are applying, okay? So see you soon. Hope you're understanding everything. Again, go to our references and reading those articles. You have many information there, okay? Thank you very much. See you soon.